Hello, everyone. We're here today for the West End Journal's first ever Zoomcast interview, and we're speaking to our community's Member of Parliament, the Honourable Dr. Hedy Fry. Thank you, Dr. Fry, for taking the time to join us today.
My pleasure, Kevin.
The consensus certainly seems to be that the Government of Canada has done an amazing and effective job during this last few months in response to the COVID-19 crises. Certainly, compared to so many other jurisdictions, we're very fortunate and we're very grateful. So I ran some questions on our Facebook page past our readers and followers to solicit their questions and see what they would like to talk about. And the consensus there was that that we've done a great job. No point in quibbling over the details. The readers seem to want to talk about how things will look going forward and what the future might hold. So I have three questions that, and I'll start with the one that most people were asking, and that was the crisis has brought into the spotlight the disparities in support across the board for our seniors, the disabled, and people on social assistance. Has there been any internal government discussion about taking advantage of this moment to look seriously at a universal basic income to ensure that some of the measures we had to take won't be necessary in the future in the event of another crisis, and to just across the board lift a lot of people out of poverty or below poverty levels?
I think, that's a very good question, because obviously the basic idea when COVID-19 hit was to just do everything we could to stop the spread as best as we could, and to also recognize that locking down meant a lot of people weren't going to have any income. So I think we just set out to help people, workers, businesses, and non-governmental organizations, civil society. And in doing so, I think the Prime Minister likes to say this often. He said it often. He said it exposed a huge number of big cracks in our system, both the economic system of economics and the system of the social infrastructure that we have. And so what he said is that we obviously can't go back to leaving those cracks there. And obviously we can't just paper them over. We're going to have to actually substantially close them. Now, basic income supplement is one. I mean, of all the things we can do to deal with, the poverty, a difference in income disparity for a lot of people. One of the things that some people are suggesting is basic income support. Other people are coming up with other complex ideas. So, it's all at the moment being, what are we going to do and how are we going to do something about this? It's going to be a sustainable solution, a solution that will really work for the long term and not just something that's going to just cover it all up. And so, as you see, we started looking at, we passed a bill last year about people who are disabled. So we're going to be building on that. We've looked at how, you can't just do a one size fits all. And that is something actually that is very, governments and bureaucrats tend to go like, let's do this. Here's a thing. And it's going to fix it all. And I think after a while, if you've been in government for a while, you realize one size does not fit all, and that you have to actually tunnel down and come up with a whole lot of understanding of all the factors that are involved, and trying, therefore, not to just do this one-off thing. So I think that's all of that is being discussed right now. But I think there are some people that are even more vulnerable than others. For instance, when we were looking at this whole issue, I realized that there were a lot of seniors in my riding who did not have a device, didn't have a computer, didn't have an iPad, couldn't afford Wi-Fi, could not afford cable. So they were existing on like a landline phone. And so in many instances, as television was giving you everything every day, and we had all these emails and we were putting it out on the web and stuff, and there were a bunch of people who weren't even seeing it, not just seniors, but, low-income single moms, low-income people who don't have any of those things either. And so when we were sending them off to the portal to put their name in and to get their thing, a lot of people didn't have portals. And so that was one of the things that we discovered. And we are now pushing the agenda on saying you're going to have to get everybody connected. And don't forget, it's not just geography in Canada. It's not just where you live that's a problem. Poverty is an issue, the cost of it. So how do we provide people with basic connectedness that's not going to be very costly for them and they can afford it? And what other ways we can get it to people who, no matter what you do, will never be able to afford it? So I think that's one of the things that came up. And so we had to then go ahead and decide we cannot let this group of people know nothing about what's going on because of lack of cable and lack of internet. So we sent out, in the very first week of this, 3,000 pieces of mail to seniors and people who we realized had no email that they can use. And so that was a difficult thing because we knew who they were, because when we looked at the voter list, we would have a phone number, or we may have an email, but we may not have both. And so we had to do that. And we then went to some of the businesses in our riding in the West End kind of agreed to put stacks of data and information on their counters, and people could come in and pick them up if they didn't have access in other ways. But it was something that we were able to point out. And the other thing we were able to point out is that when we had a 1-800 line for kids' help, when people were, especially people women and children who were forced into staying at home in an abusive relationship, who didn't have anywhere to call for help. I mean, that 1-800 kids line worked for them, but for a lot of people, we needed to think about how we got seniors who were completely cut off and who were going to go into spiraling into depression from isolation. How do we look at them calling for help? How do we look at women who couldn't say boo on the telephone to their friends because the person that is being violent at home might hear and might give them trouble? So what are the ways that they can do it, and how they can get messages out? So that's something we discovered. This is an important thing. And so we went ahead and we spent a lot of time putting out our telephone number, mainline number, our mailbox number for those who could mail us on email, etc. And so my staff, who have been working 24/7, and we've only just begun to let up, I would say this last week, they were answering, we parceled out the work. They were answering the calls on a daily basis from morning till evening, given that Ottawa opens at 6 o'clock our time and closes, but we still had to keep it up after that closure time for them to give them the 3-hour time difference here for us. And then we had a person dedicated only to answering Gmail and snail mail, giving them the data they needed, telling them where to go, helping them with some of those problems. And we did a lot of outreach as well. We called businesses and we did Zoom conferences with students, for instance, roundtable with about 25 students. Students were saying, what's going to happen to us? What's happening? We were able to hear from them about what sounded okay, what sounded like it would work, but what wouldn't work. And so we were able to float that on a daily basis up to the departments responsible, up to the Prime Minister's office, and say, guys, this sounds good on paper, but it doesn't work for X and Y and Z. And then you would see 4 days later, the Prime Minister would say, oh, we've changed this. And that was because of all that input that they were getting. And they really didn't want anybody to fall through the cracks. But so they were just trying to fix things as they heard about them. I mean, I met with sex workers, by the way, who are the most invisible people right now. They don't work, right? They don't have an income. They don't work as far as the world is concerned because the work they've done is still criminal activity. So you have these people who need to feed their kids, who need to pay their rent, who are really stuck. And I had a roundtable with about 30 sex worker organizations. And we talked about what's happening in the West End, where people who were trying to escape COVID left the downtown East Side, homeless people, came into downtown West End, into Yaletown, trying to be separated from the masses and trying to achieve some kind of social distancing, couldn't find businesses open, couldn't find toilets, were creating a public health hazard in terms of defecating and stuff. So we worked with the mayor, and we worked with the provincial health services, and we worked with the Western BIA and with the downtown BIA to try and get some of those things fixed on the fly and on the ground. So we have been, restaurants, I didn't know the problem restaurants were going to face when there was a reopening. Many of them tells me that they had to borrow, the independent restaurants, the medium-sized ones, like say Shambar, has to borrow $60,000 to get all that equipment, that physical distancing, the plexiglass, to do all of that, to get protective equipment. And they have to borrow that on their own dime, with banks charging them 5%. And so then they were able to say, well, why doesn't the government give us an interest-free loan? Because what happens if there's a second bout of COVID and we close down? Many of us aren't coming back. We can't come back. We can't afford to. And then what about the little mom and top restaurants? Like, the Olympic pizza in my writing. They don't have the ability to borrow $60,000. They don't have the ability to do anything. So how about government looking at giving them grants to help them to start up again? Because obviously if businesses can't reopen, jobs can't come back. And the whole idea is to get the system humming again. So I learned a bunch of things during this about what sounds great on paper and what actually isn't going to work if you tried it. So I think, in many instances, it did expose the cracks in the system for so many people who are extremely vulnerable, some more vulnerable than others, and the ability to be able to keep in touch and the ability to be able to get information. I mean, those are the things that the Prime Minister said, we can't go back to the good old days, we're going to have to fix it. So coming up with ideas of how to fix it not only means talking inside the tent, but it also means talking to groups like the restaurant, like the small business associations, like seniors, like sex workers, like students, and saying, yeah, so what do we do in the future? How do we get a sort of some kind of long and medium term system that's not going to allow those cracks to continue? That's a difficult situation. Yeah. It's hard.
And as you said, the solution has to be long-term and sustainable. So yeah. I guess we're wondering what the process is that the government has in mind to initiate consultations. Do you form a commission? How does that look on the ground?
Forming the commission, if you don't mind my saying so, takes like 6 months. And then the report takes another 3 months. And I don't know that people can wait a year for some of this thing to happen. And I don't know that we can fix everything in one fell swoop. So what we're going to do is to look at some of the issues that are really glaring, that people are really, really vulnerable in terms of those issues, and start finding solutions. And now, I think it would be that ministers may have to start doing what we're doing now, for instance, going out there on a Zoom call and talking to community groups and talking to organizations and saying, what do you think? I know I brought in a minister to do some of that talking. I'm bringing in some of the ministers to do the talking with groups and say, here I am, listen to me. What are you going to tell me? What do you think I should know? That kind of thing, that would work quicker, faster, will catch local groups better. And, every MP can do that, and as well as ministers, and feed it back into the system. Because I was actually pleasantly surprised at how on a daily basis we would talk. Okay, we were talking on a daily basis, and we were sending stuff up, as we would say, the food chain, saying, by the way, this sounds great, but we're now hearing from people that isn't going to work for this group, and for people who own a very small business, people who landlords who have to pay huge mortgages on their properties don't want to take the rent assistance because it doesn't pay their mortgages for them. All of those kinds of things, and the results and the responses came back within 48 hours. I would send stuff up the food chain, and I would get a response from a minister within 8 hours. Well, like, yeah, Hedy, thanks God. Yeah, we're hearing that from a bunch of other people, and trying very hard. But that was the immediacy of response. I think we now have to sit down and talk about where we go and how we do it so that it really works for everybody, and that we really recognize that we cannot go with one size fits all anymore. And how we build relationships with provinces, Kevin. This made us, provinces and federal government were talking. And it was going like, I don't care if it's provincial jurisdiction. Feds were saying, okay, we'll give you money to help with this. And because we don't have any control over commercial rent, right? That's not a federal issue. But then we would say to the provinces, look, what do you want us to do? Tell us, we would do this and we can work together and find solutions to certain things as they pop up. Now with that, we can't go back to the old, oh, this is my jurisdiction, this is your jurisdiction. We're gonna have to learn how to partner from now on, if we're going to keep those cracks from opening up again. We're going to have to learn to start building some trust.
So what I'm hearing you say, Dr. Fry, is that one of the outcomes of all of this is that we will see a sea change in communications between all levels of government. And
Chrystia Freeland has been doing this a lot. Every day, I don't know if you know, every day Chrystia Freeland talks to provincial governments, talks to municipalities, talks on the phone to them just every day, hearing what their problems are, hearing how this doesn't work, why this doesn't work, what needs to happen. So I think we've already established a kind of rapport. And other than having some provinces who have worked well with us, I mean, who would have thought that Ontario Doug Ford would be sitting down every day with Chrystia Freeland saying, yeah, we got to do this, yeah, we got to do that, yeah, etc. It's happened. Now, what we have to do is to have the political will not to let political partisanship get back in there and start creating problems. Yeah, we're going to disagree on a bunch of things. That we're not going to suddenly become, singing Kumbaya, dancing down the street. There are going to be political differences. There are going to be ways of doing things that we don't agree with from a political perspective. But at least we can start finding common ground to do things that we can do, things that we don't differ greatly on. Because at the end of the day, this is about Canadians, regardless of where they live. This is about Canadians, regardless of their socioeconomic status. This is about Canadians. And if we're going to collect Canadians' taxes and don't want to help them all regardless and try to bring political partisanship, this is a new model we're going to have to think about. I don't think it's going to work fully and quickly, but we have to work with good faith with each other now. There has to be that political will. Some provinces, I think, are already saying, no, we don't want to work with you. I mean, I think it's going to be up to their citizens to say, their populations to say, hey, don't do that. Come on, stop it. You were able to do it during a crisis. Let's continue to do it. Well, I'm hoping that will happen.
Let's hope that is the outcome. And I know that our readers and our listeners, we're all hoping to hear you say, yes, we're going to have a universal basic income, but we also all know that realistically it's going to take time. That there are many, many complications and things that need to be listened to, looked at, and addressed, but it's good to know that it's now on the agenda in a forceful way, and we look forward to taking part in the conversation and the consultations and helping move towards something like that.
It's one of the solutions on the agenda. Some people are arguing against it because of the complexities. Some people are saying, no, let's go for it. I mean, as you well know, you start talking about these things, and for every 3 people in the room, there are 5 different opinions.
Exactly.
Right.
So,
but we will hammer it out.
Our second question, if I may, and it's related. Of course, these questions are all related. But one of the other things that quite a number of our readers brought up on our little informal survey regarding the overall issue of senior care in our communities. While much of that is normally a provincial jurisdiction, I guess the question is, does the federal government have any tools that it could apply to standardizing levels of care, potentially taking senior care out of the private sector, and ensuring decent wages, working conditions, and benefits for care workers?
Well, my personal opinion, and this is my personal opinion, not saying it's my government's opinion, my personal opinion was we missed the boat when we created Medicare and the Canada Health Act, and we did not put in long-term care, assisted living, and home care in the Canada Health Act. At that time, we were negotiating, provinces didn't want those things on it, and so we had to go with what we got at the time. But pharmacare could have been negotiated, mental health could have been in the Canada Health Act, but we had a lot of resistance to all of that at the time. And what I think at the time, the people that were doing it looked at it and said, look, let's just get some universal health care for people who to get the health care they need when they need it, regardless of their socioeconomic status and regardless of where they live in this country. But now we're having to go back and say, hello, what can the federal government do? Well, the federal government began to get involved in long-term and seniors care in institutions because of the problem that occurred, because of the high death rate, because of everything. And we called in the armed forces to go in there, and it was the Army that found out the rot in the system in many instances, found out the massive holes in the system and how the system didn't really work. Now, I think the federal government, having helped with some things in the healthcare that we did not have provincial responsibility for, it was a federal, we had to let the provinces do it. The provinces said to us, come, we can work with you on this. Let's let you interfere in this over this pandemic. Well, now the federal government, I believe, is going to have to find a way of saying, okay, it worked, didn't it? We caught some things. Let's make sure that we begin to talk in good faith again about how we deal with certain things and with each other. The only way the federal government, under the current system with federal provincial jurisdictions, can deal with making provinces do certain things or changing the way provinces do certain things is with something called cash. And so if the federal government gives cash, there are a whole bunch of us that say you can't just give cash without some strings, and in some cases a rope attached to it. You've got to put conditions on what you're giving cash for. You've got to target what you want to give cash for. So let us imagine we sat down with the provinces and we said, okay, I know this is your bailiwick, home care and long-term care. I know that under the health accord with Paul Martin in 2004, we put $42 billion into saying, can we buy our way into participating in home care and long-term care and in primary care and in mental health and in pharmacare? We did that. And so I think we have to go back and talk about that, because that only lasted a year and a half. And as you know, Paul Martin lost the election and we went into a government that didn't care anything about healthcare, really. They think it's a burden and a horrible thing and would prefer to be seen privatized. So we have to now go back and try and say, can we give you money, say, for provinces that have a high percentage of seniors? Can we buy into this with a certain amount of money targeting seniors care? And here are some of the conditions we want to put on it. You can still deliver it, you can still do that, but here are some of the conditions we want to put on it. Now, the work on deciding what those conditions are still has to be done, right? And it has to be negotiated. Everything is about negotiation. But that's one example. Let's take youth at risk. Can we send money for youth at risk to provinces that have a high number of young people in their urban areas that are at risk? If we did that, can we target the money towards spending it specifically on that instead of on general health care? Can we talk about the mental health? Can we decide we can put some money into mental health in a way in which we can target that money for mental health? Some of this is already going on, by the way. There are some pilot projects that have been happening now over the last few years to try and do this. British Columbia is actually doing it with primary care physicians looking at mental health problems and mental health issues and getting it into the system by targeting money for it. So I think that's one of the things that we could look at. How do we target, buy our way in? But for some of us, like me, an old codger that I am saying you don't give money until you put some strings or a rope. Otherwise, how are you going to control how it is being spent? And there needs to be that kind of thing happening.
Well, and I think that again, that's going to be supported by this change in the communications between the different levels of government, and the fact that every level of government has now seen the cracks in that system very clearly. So,
but Kevin, I just want to say one thing. I've said it all, and it sounds very logical, right? On when I say it, and when you say it, and when we all say, well, it makes sense, doesn't it? Everything is about negotiation. Everything is about goodwill. Everything is about political will. And so we are going to have to be very careful that we don't jeopardize making these things happen because we play partisan politics. We're going to have to walk ahead there with a certain amount of principle and say, look, guys, you know, I don't really care who runs your province, but it is about the people, and let's try to do this. And that's not going to be easy. Some places it's going to be like a piece of cake. In some provinces, it isn't. In some provinces, it's going to be resisted. In some provinces, it's going to be taking a long time to get it done. But once again, I think what I have learned about politics is that everything is about getting to common ground. Everything is about coming to a point where everybody can agree on what we want to achieve and then iron out how we achieve it. And so this is what I'm saying. It's not going to happen tomorrow. It's not a silver bullet. It's not going to just suddenly click a finger and all this is going to happen. But I will tell you, and I will say it, and I'm just showing you my nonpartisanship here. This particular government in British Columbia has been one of the best governments the federal government have found they could work with. There was a whole amount of saying, yeah, we got to get this done because people are suffering, because people are in jeopardy, because blah, blah, blah. And then you have provinces in which it's pretty difficult. But I will say that for me as a British Columbia MP, federally, I know we can do some things with BC that's going to, and then maybe that can show the rest of the provinces that, hey, here's something that worked. Here's how it can work well. And that might just be the best practice thing. And we may have to do a bunch of best practices for people to move into the system. But there is no easy way the federal government say you do this or else. That's not the way you negotiate.
Right. And we certainly understand that, I hope. The third question, Dr. Fry, kind of segues from something you said about, attaching strings and sometimes ropes to largesse from the federal government. We can put money into this, we can put money into that. The federal government has put a lot of money into this emergency situation, and it's far from over. With the CERB and the other support mechanisms being extended, and who knows what's going to happen this summer, one of the things many of our readers are asking is, how are we going to pay for this? Will we be looking at new taxes, like wealth taxes? Will there be austerity initiatives? And what might that all look like? How are we going to cover these bills?
I cannot answer that question right now because that is stuff that everybody's beginning to say, how do we do it? Everyone is now asking that question, even within political parties and within governments. We're all saying how that's going to happen. But I can tell you something about the deficit. When COVID-19 hit Canada, we were the best performing economy in the G7. We were by far and large the best. Our debt to GDP ratio was really low. It was manageable. And so when this happened and we had to borrow money, we were fortunate to be able to borrow money from ourselves. So our debt to GDP ratio is still good enough for us to be able to say, we can manage to repay this. Canada, the Bank of Canada dropped interest rates, all of that, bonds, floating bonds, all of that to help us build back and repay again. And that is one of the reasons why we need to have a very strong, we've been talking about social infrastructure, social renewal. We need to talk about a very, very strong economic renewal plan. And that would be getting people back to work, getting businesses back to functioning, getting back into trading with countries that we can trade with. Canada is a trading nation. I know people think that we can stand on our own 2 feet. Canada depends for, I would say, almost 50% of its gross domestic product on trading with other countries. And so we need to continue to look at how we can manage trade. We need to balance that off with human rights and all of that, violations and stuff with certain countries. But at the end of the day, we need to do that. We also need to build strong businesses that are not only dependent on the old resources, like the old natural resources that we had. We see oil and gas is going to be under strain as time moves forward. And lumber is at a standstill right now. China tends to buy most of British Columbia's lumber. Is it going to want to do that in the future? We don't know. So there are tons of jobs hanging on an old trading system and an old economic model. how we move into the 21st century, how we become a player, a productive and a competitive player in technology, in creativity, in innovation, in all of these new things that we're talking about, that which depend on the people that do them, and not on the things that are beneath our feet on the ground, but the people that walk on that ground. So how do we look at education and training and skills and helping young people to get the kinds of things that they need for this kind of new 20th century, so that we can be a productive and competitive country? Those are some huge challenges. They're not simple, but we are very aware of it, and we're trying to look at what is it that Canada has a history and a reputation for being good at. We do have a history and reputation for being very good at biomedical technology. And our public healthcare system has been very helpful in that we have on hand all of the data we need to gather that's been kept in provincial governments' pockets, that we can go and reach into in a non-nominal way, so we don't know who the people's names are, but we know, number AX, this is how we have, and we have a diverse population that responds in different ways to different things. So we have a good amount of data, and we have shown ourselves to be extremely good and extremely competitive in biomedical technology. We're extremely competitive in aviation and space. And as you well know, McDonnell Detweiler is now the top international company in the world, and it's mostly Canadian owned. So aerospace, that's one of the things we're known to be good at. Communications technologies is another one that we're known to be very good at, which is collecting data, collecting information, disseminating, etc. I don't know if you know that in British Columbia, McDonnell Detweiler started RadarSat-1 and RadarSat-2 out of government funding under Chrétien when I was in government. And actually, that's the basis for Google. That's the basis for GPS. That is the basis for a whole lot of things. A lot of countries tended to buy that technology. So that's the third one we're good at. And then the fourth one, I think that we are known to be very, very good at is environmental technologies. And yet there are some things we can learn. But at the end of the day, I think the ability to get back into a strong economic model is that the world is going to have to change, not just Canada. We're going to have to start believing in multilateralism. We can no longer be fighting each other and going at odds, either in true conflict and war, or either fighting each other and being at odds and see who gets to the goalpost first. We're going to have to share data. We're going to have to share information. We're going to have to share innovation. We're going to have to share healthcare technologies, so that when the next pandemic comes, we are ready. We have stuff. We're not wasting our time running around in our little thing, guarding our own things, guarding our own piece of the pie. We're going to have to learn how to do things differently. And a lot of people are talking about that. I know Europe. I work very closely with the Organization for Security and Cooperation in Europe's Parliamentary Assembly. It's made up of 57 nation states, including Canada, the US, Turkey, who's outside of that, and the European Union and Central Asia. And we are all talking about how we share data, how we share information. Of course, there are a couple of countries that aren't willing to do that right now, but a lot of countries are now reaching out and saying, how do we work together? And Canada is at the forefront of spearheading that at international fora and on the international stage. How do we share information? How do we share data? How do we share what we know? How do we share vaccine growth? I mean, how do we share treatment? How do we share that information? And I think as the United Nations Guterres said the other day, the head of the United Nations said, Secretary General, he said, you know what, if COVID-19 has done one thing, it's shown us that actually we all have one common enemy. This virus never cared if you were China, you were Russia, whether you were a communist country, whether you're in a whatever zone, it did not care. And so let's stop picking on each other. Let us get rid of conflict and focus, all of us, on the common enemies called pandemic. That's going to keep coming as this world is global. And some countries are talking about that. I know the OSCE is talking about it. I know that the United Nations, I was just on a conference, a webinar I spoke at this morning about how we can get moving on that kind of thing and getting rid of conflict and starting moving towards building a world where human capital, including gender and including races and everybody, is valued as the biggest capital we will ever have. And
So
how do we make sure that
would it be fair to sum up then by saying that the goal at the moment and going forward is to reboot the economy and to work nationally and internationally on a new international economic model, get us back in business so that we don't have to do any extreme measures in extra taxes or austerity measures in order to survive this?
I think in some ways, yes, Kevin, because the Prime Minister has said very clearly each time when he's asked this question, is that we borrowed from ourselves. So we don't have to worry that the World Bank will come after us. We don't have to worry about, some countries do have to worry about that. Some well-known G7 countries have to worry about it. Some G20 countries have to worry about that. And so I think what, again, I'm back to saying, you know, it all sounds nice when I say it, but it's not a silver bullet. It isn't going to happen. There are people who are going to continue to want to jealously guard what they have and what they know. There are people who are going to continually want, because they've been doing it for 300 years, to fight each other and to continue with conflict. There are people who, because we're seeing it in Europe right now, Poland and Hungary are now turning into right-wing. I mean, COVID exposed a lot of things we need to do differently, but it also allowed certain very right-wing governments to use it as a tool to take on all sorts of powers that they never had before in a democracy and become autocracies. And we're seeing it happening in certain parts of Europe. And, you know, everyone is now aware that we have to fight that. So as with everything, it is a model, it's an aspiration. Canada is pushing for it. There are lots of countries, Germany, etc., that are pushing for this. And there are some countries that are saying absolutely not. And 3 of the world's most powerful nations are in the group that are saying, no way.
Well, some way, and it has to be. So I'm glad that we're pushing for that. And it's good to know that we borrowed from ourselves. Perhaps many Canadians don't realize that, and I'm glad you made that point. We're not beholden to anyone else at this point. I do have one final question, Dr. Fry. It wasn't actually brought up by one of our readers. It was brought up in a conversation I had recently with one of the binners in our neighborhood here in the West End. She lives in the downtown east side, but our back alleys are her territory. And we've become friends over the years, and we sit on the park bench in the mini park and chat from time to time. And we're wondering if there was any analysis done in advance of the CERB benefits and others as to the impact that this would have on at the street level on drug addiction and overdoses. Because as she tells me, many homeless people and marginally housed people on the downtown east side took advantage of these benefits, signed up for CERB, although they didn't qualify, got their $2,000. And there was statistically a remarkable increase in overdoses and overdose deaths in the downtown east side as a result of these drug addicts suddenly having all this money in their pockets. And she's wondering, and we're wondering, if that was considered, or if we're all been blindsided by this unexpected side effect.
I mean, I look at this as a physician. Somebody comes being rushed into the emergency room bleeding like mad. I don't stop to wonder how, when, where, what. I immediately stop the bleeding and I immediately give them blood replacement, right? Then I say, let me find out what caused the bleeding, right? Because the first thing to do is to stop the bleeding. And I think when COVID-19 hit and everything went shut down, like literally within 24 hours, the first response that I know my Prime Minister had, and the first response that a lot of us had was, oh my goodness, how are people going to pay their rent? Oh my goodness, how is this going to happen? And so we tried to use what we thought was probably the most foolproof system we had, and that was Revenue Canada. Because Revenue Canada knows if you made money last year or not, if you worked and earned money. Okay, they know that. So that we were saying anybody who made $5,000 up to $5,000 in the last thing will qualify. So 5 people making $5,000 and over would qualify for this. And so people started, and literally millions of people were pouring through in the first week. What we are now doing is, because all that data is being kept with Revenue Canada in a very good, solid, professional manner, is now we're going to go back and go over this and see who got money that they didn't have. And then we are going to have that money reimbursed, which may mean, I don't know what it may mean, garnishing wages that people make or whatever. And already we know that we've had people who said, oops, I lost my job for 2 weeks and then I found another one in the meantime, and I'm sending you back so much money. So you have a lot of people who are responsible and etc. And you're going to always have people who are going to take advantage. So I think that the idea that we think that a lot of people abuse the system and then went off and used it to buy drugs, that is not the response we have to the drug addiction. That is not the response we're going to look at. The response we're going to look at is when we go back and we audit people who got sued, is to find out whether they actually really qualified or didn't. And then go after getting the money back in different ways, or finding ways to get that money back in different ways. So that is a certainty that we're going to do. So we gave money to 2.8 million people in the space of 3 weeks. Okay, with public servants who didn't have the ability to deal with 3.8 million people in the space of 3 weeks. So, I mean, and people were already, some people were complaining right now that they were on EI. Because they had lost their job and they were bona fide on EI, and that because of that, they were eligible for CERB. And then there were some people that were saying, well, I was in mat leave. I was get pregnancy leave and I can't get CERB because I was getting EI because I was on pregnancy leave and not because of COVID-19. So there are a lot of things that we've learned and a lot of things that we're planning to do. But I think that the issue of overdose and overuse in the downtown east side. I was very involved with Philip Owen at the time when we signed the Vancouver Agreement, and when we looked at creating the safe injection site in the downtown east side. I was very involved. Gretchen had made me the minister responsible for that because I happened to be a doctor and because I happened to come from Vancouver. And we worked very, very well to look at some of the things we need to do. And the first thing we need to do is to look at substance use as a health issue. And we need to start looking at how we, prevent overdose deaths and prevent deaths, because we do not allow people to go and buy off the street and from organized crime who exploit them and keep them trapped. So, everyone now is talking about a safe supply. In lots of countries in the world, and I traveled to Switzerland, and I looked at the Scandinavian models that are thriving right now. This is about safe supply. And it's not about it's about getting rid of organized crime. That's a first and foremost thing. And so we've seen that work with some success elsewhere. And so we need to talk about addiction and substance use as a medical issue, and do what we can, A, to prevent, B, to reduce harm while we're trying to treat people, to go with treatment, and to allow people to have treatment. Now is being considered. Part of treatment is called safe supply, is a part of a treatment. And countries that are doing it, many of them, Finland, Norway, are finding very solid results. People are actually getting back into the system. They're working. They're not having to rob somebody on the street to make $20 to buy tainted stuff. They're actually able to be on a list and to get their medication and to take it and to start going back to school. Many of them are going back to school. They're learning new skills. And these are people who were at high risk and hopeless. They lived on the street. They didn't have anything. And one is seeing good results. So as a doctor, I always look at evidence. Let's look at best practices. I always look at what doing this particular thing will show us. in the long run, and how we are going to decide whether it will work for us or not. And so I think that
I think
the idea, yeah, the idea that we think that, yes, of course, we know people who will always abuse a system that's there to help. But we cannot start off wanting to help people by saying, I can't help you because I don't know if you're going to abuse it or not. You have to have that kind of compassion that says, I just want to help you out right now. And then we will deal with the fallout.
I understand, and I think there's certainly a general agreement that it is a health issue, not a criminal issue. But my friend, again, my park bench pal, you're talking about looking now at who got the money and didn't qualify for it and getting it back. She asked about that too, and she said most of her neighbors down in the downtown east side are on welfare. She did not apply. Everybody was trying to encourage her to do that. And she said, no, they're going to claw it back, and I don't want to be paying it back. And the response of her peers was, well, they can't take it out of my welfare. And she said, well, no, maybe they can't take it out of your welfare, but you'll stop getting your GST rebate. You get that, and they'll probably take that back.
I don't think we will presume how we will do those penalties, but we will have to do what is an audit. No matter what you do, you audit it. And that's what a CRA is going to do, an audit. And then we're going to have to find ways of dealing, as I say, you can't have one general solution for this. You're going to have to say, well, what about persons who are getting it because they're on social assistance? What about persons who just lost a job the day, but not because of COVID-19? What about people who, didn't tell the truth or were collecting the wage supplement at the same time? All of those are going to come out in the wash because we can do that. At the moment, if you think about it as an emergency room, you got to stop the bleeding first. You got to protect people first.
Yeah, no, and we do understand that. Dr. Fry, I really appreciate your time today. Do you have anything you'd like to wrap up by saying to the West End, Cole Harbour communities about the situation in the moment and how we should be being kind to one another and following Dr. Henry's instructions in the weeks and perhaps months ahead?
Well, I noted you said Dr. Henry. I'm thinking of Henry Higgins right now. Okay. No, I'm just saying that what I want to tell people is this. We have seen countries that actually stop the spread early in the game. Places like South Korea, places like Taiwan, places that were showing good outcomes, going into a second phase right now of COVID-19, which is a worse phase than the first one. And I want people to know that while we are slowly trying to open up and get back to having, an economy moving and jobs and whatever, we need to remember that COVID-19 has not disappeared. And that we need to continue to remember that while we are increasing our bubble to 5 people, make sure that we still socially isolate wherever we can. Make sure that the people that we're opening our bubble to are people who are following the rules for public health and socially isolating. Let us make sure that we do not go into crowded situations and forget the social distancing, because that is where we're going to get the contamination reappearing. We need to make sure that we continue to wash our hands for 20 seconds, that we continue to cleanse our surfaces. This is a droplet infection. And as I'm talking to you now, I am not spitting. I don't spit when I speak. But the very act of air coming through my larynx so I can give you words means that there are microscopic, very microscopic, you cannot see it with the human eye, droplets forming in the air. We know that those droplets stay in the air for 3 hours. We know that those droplets land on some surfaces, and on some of them they stay for 4 hours, and on some of them they stay for 4 days. And we need to be wary of those things. And that's one of the reasons why wearing a mask is not to protect me from you. If I wore a mask, it's to protect you from me. It's for that droplet not to be spraying out there. But it still means I got to socially distance. It still means that I've got to remember that we could have a second wave and that it's going to be worse than the first, because there are going to be a whole bunch of people who have been made vulnerable by some of the lockdown, by some of the things that are going to flare up and be vulnerable again. We're now seeing globally that children are now spreading COVID and are getting COVID with some disastrous effects. We're seeing all these young people in their 20s and 30s and 40s who are not getting the lung problem, but they're getting clots, they're getting heart problems, they're getting kidney problems. They're seeing things in them that we didn't expect. COVID-19 is a very clever virus. It is continuing to surprise us. So we cannot take everything for granted, and business is not as usual. It is business with caution.
Thank you for that reminder, Dr. Fry. That's important for everyone to remember. And we're doing that here. And that's why, unfortunately, you won't be invited to my 70th birthday party next month, which you were going to be.
Are you going to have a Zoom party?
I don't know what I'm going to do. I'd taken the lounge at the PAL Studio Theater. I was going to have everybody I knew in the world come, music and drag shows. But maybe for my 71st, we'll pretend.
What you may want to do though is you could possibly, because I know the PAL Theater, I know the PAL Auditorium, and it's outdoor garden. You can say, look, I will invite 25 people that I love the most, and we can socially distance and have a good party.
Dr. Fry, could you narrow the people you love and care for down to 25? I sure couldn't.
No, but you're going to have a pecking order there. You're going to have a pecking order. I mean, it's been a tough time, and we've seen people who can't even go to their funerals of their loved ones. But now we're able to say, look, we can't have it all, but maybe we can have some. Maybe we can have a little piece of cake.
With
not
caution,
the whole cake. With caution.
And caution. Thank you so much, Dr. Fry. I appreciate your time. This has been fun and informative, and maybe we can do this again. Maybe the West End Journal's Zoom interviews might become a regular thing. So.
Exactly. Anytime you want me to answer questions or to be involved in looking at where we go from here, or actually hearing from constituents and from others about where they think we should go. I mean, there is no such thing as a silly solution. All solutions at the end of the day require looking at, analyzing it, turning it over, and finding out that there may be a gem hidden in there somewhere.
Thank you again, Dr. Fry, and thank you to your staff for setting this up and making it happen. And we'll see you on the other side.
Yeah, we will. Okay. Bye-bye.